The UAMS Translational Research Institute is proud to recognize the following outstanding community partners that have helped make various endeavors at UAMS possible. Immerse Arkansas. In the spring of 2016, a pilot service learning project was integrated into a qualitative research course. UAMS faculty partnered with Immerse Arkansas, a nonprofit organization that prepares former foster youth for adulthood. The goal was for students to interview youth who receive services from Immerse Arkansas, then write narratives for inclusion in an awareness campaign. The project was valuable to students, faculty, and Immerse Arkansas. Eric Gilmore, the executive director of Immerse Arkansas, was very gracious, sharing his passion to support foster and homeless youth. He took the time to not only prepare the students for the interviews, but also arranged for the interviews to occur at the Immerse Arkansas office. Transgender Equality Network. The Transgender Equality Network has been a partner of the Arkansas Transgender Equality Coalition, ARTEC, for several years and has played a major role in engaging the transgender community in Northwest Arkansas. Dale Manning is a community liaison for the Transform Health Arkansas initiative of ARTEC in Northwest Arkansas. The Transgender Equality Network has consistently served and advocated for the transgender community and has worked to educate the broader public about transgender issues. Its valuable work also includes being a partner in the Transform Health Arkansas initiative, in which it has engaged the transgender community to share their health concerns. Jericho Way. Jericho Way has partnered with Emergency Department Community Health Worker Program. Jericho Way is a day resource center for the homeless in Little Rock. It has been an invaluable partner to the new Emergency Department Community Health Worker Program at UAMS. In this program, patients in the emergency department receive one-on-one services from a community health worker who works with them to manage their health and social needs. The Emergency Department Program's partnership with Jericho has helped us serve community members who find themselves homeless or struggle with substance abuse. Jericho's staff, particularly their social workers and volunteers, work with the community health workers to ensure patients get what they need when they are leaving the emergency department, such as helping to provide transportation and general social support. UAMS community health workers and care managers work closely with Jericho Way to arrange referrals and patient care plans for obtaining vital resources like housing or rehabilitation. This partnership is a wonderful example of how real partnering can make a huge difference in the lives of UAMS patients. Jefferson County Emotional Wellness Task Force. The Jefferson County Emotional Task Force has worked with several UAMS investigators to develop grants that focus on improving mental health outcomes among community members and improving mental health literacy within rural African American communities. The task force has also collaborated with UAMS investigators to develop grants that focus on improving mental health outcomes among incarcerated individuals. After the completion of a Patient-Centered Outcomes Research Institute pilot project, this group of individuals took it upon themselves to form the Jefferson County Emotional Wellness Task Force to continue the important work of improving mental health outcomes within their community. This task force has been involved in providing mental health first aid training that raises awareness about mental health problems and treatment options. Additionally, they have continued working with UAMS investigators to work on grants that will fund important research about the most effective ways to address mental health problems among community members, individuals who are currently incarcerated, and those who are re-entering the community after incarceration. The Translational Research Institute would now like to recognize the nominees for the Chancellor's Community Research Partner Award. The award will be presented to an outstanding community partner that has participated in research. Tri-County Rural Health Network. Tri-County Rural Health Network, Tri-County, has been a partner of the UAMS Fay W. Bozeman College of Public Health since 2001. That year, the college and Tri-County began the Community Connector program. They have jointly presented and published findings on the cost savings generated by a community health worker program, which has influenced funding in Arkansas for community health workers. Since that time, Tri-County has served as the formal community partner on a grant from the National Institute for Minority Health and Health Disparities to study the role of community health workers in engaging minority community members and organizations in research. Tri-County received almost half of the funds from this grant, with Dr. Mary Olson of Tri-County serving as the community co-investigator and Naomi Cottums serving as chair of the Community Advisory Board. Tri-County also served as the community partner on a Patient-Centered Outcomes Research Institute Award. The College of Public Health is currently collaborating on a research project with Tri-County called Patients Advancing Their Health, PATH, in the Delta, which involves integrating community health workers into primary care practices to help them serve the needs of their most costly and medically complex patients. Tri-County has consistently been willing to step up to the plate to partner with UAMS from the beginning, when such partnerships were not common, trusting the UAMS College of Public Health to help build its capacity to work in the community and to grow its own capacity to partner. Shiloh Baptist Church. Pastor Johnny Smith and the Shiloh Baptist Church in Pine Bluff have partnered with researchers at the Veterans Administration, UAMS College of Medicine, and the UAMS College of Public Health for over 6 years. Pastor Smith has served as a community principal investigator on several projects including Faith in the Delta and Rejoice. As a community principal investigator, Pastor Smith has assisted with recruitment, data collection, data analysis, and intervention development. In fact, his work on the Faith in the Delta project resulted in the development of a faith-based depression intervention that is currently being tested in the Rejoice project. As a result of his research experience, Pastor Smith has served as a mentor for other faith leaders interested in partnering in health research. Specifically, he has worked with researchers in Northwest Arkansas as they provide partnerships with faith organizations in the Marshallese community. Pastor Smith and the Shiloh Baptist Church truly embody the meaning of an outstanding community partner in research. Not only have they participated in research as a partner, they have worked tirelessly to increase the capacity of other faith organizations so that they too can partner in health research. UAMS research has been enhanced because of their participation. Arkansas Transgender Equality Coalition. The Arkansas Transgender Equality Coalition, ARTEC, is a statewide transgender-led organization that works to advance equality, justice, and inclusivity for transgender Arkansans. The College of Public Health at UAMS is a partner of ARTEC on a National Patient-Centered Outcomes Research Institute Community Engagement Award called Transform Health Arkansas. ARTEC is leading this project to engage transgender Arkansans in identifying their most pressing health needs and healthcare issues they want to see studied. In the first year of the project, ARTEC held 9 summits around Arkansas with the trans community and learned of their top concerns. They established a research working group comprised of transgender Arkansans, providers, and researchers. The research working group meets monthly to guide and help to implement the work of the project. Outcomes include successful completion of the Tier 1 award, in which top concerns of the community were identified, and the receipt of the Tier 2 award, in which the partners will continue this work and develop a comparative effectiveness research question. Through this working group, more than 30 presentations have been made by transgender Arkansans to increase understanding and decrease stigma and discrimination. Working in partnership with educational, service, and advocacy organizations, the Arkansas Transgender Equality Coalition has successfully engaged a very marginalized and vulnerable population. Arkansas Community Organizations. UAMS College of Public Health faculty, staff, and students have partnered with Arkansas community organizations in completing service learning community research projects for the previous 5 consecutive years. Arkansas Community Organizations is a community-based membership organization that does community organizing around issues that are important to its members, mostly low to moderate income communities in central Arkansas and Jefferson County. Arkansas Community Organizations is the partner for a master's and doctoral level course on racial and ethnic health disparities. Every year, a service learning project is completed that requires primary data collection, analysis, report writing, and community dissemination on a project that is based on social determinants of health. These service learning research projects are designed to respond to real-time policy debates or decisions occurring at the state or local level. Each year's project reveals different impacts, and the findings are disseminated to the appropriate policy-making entities. A main goal of each year's project is to bring a health lens to an issue that has not been considered a determinant of health. For example, in a project that focused on displacement as a result of a proposed development, many development stakeholders were influenced by findings about its negative community impacts, and it was ultimately built in a non-residential location. The partnership model has been presented at multiple regional and national conferences. The Arkansas Community Organizations projects serve as examples of truly community-driven research. Arkansas Prevention Research Center Community Advisory Board. The Do's and Don'ts of Community Engagement workshop was developed and implemented by the Arkansas Prevention Research Center's Community Advisory Board in partnership with faculty and staff from the UAMS College of Public Health. Teaching approaches include video testimonials, simulations, role reversal, group reflection, and debriefings. The workshop was engaging and successful in motivating researchers to adopt new perspectives, acknowledge power imbalances in community campus partnership development, self-reflect about their role as researchers, and consider solutions to these problems. Other outcomes include development of relationships leading to new community-engaged research projects, unanticipated learning experienced by community member participants, and requests for additional workshops. The results of the Community Engagement Workshop suggest that such community-led educational interventions offer a promising approach to building and sustaining authentic community academic partnerships.